I want to welcome everybody back to our COVID-19 Innovations webinar. This is day number 9 of the webinar. I hope that everybody is finding some benefit from the exchange of ideas and collaboration that we've been able to put together here with our county partners. Today we have a little bit of a different angle with this webinar. Previously, we've had videos and that sort of thing, but today we're going to have sort of a live chat with our physician leaders at the EOC. We have Dr. Mike Masiska, who's the chair of our emergency department, as well as Dr. Jeff Leung with us, who is the chair of our ambulatory services. I think it's a great opportunity for them to be with us today to give us a little bit of an update on what's happening at the EOC. I know they and the rest of the team have worked terribly hard to develop strategies to combat the crisis that we're under. As everybody is aware, there have been aggressive mitigation strategies and messaging out to the public on how we can potentially flatten the curve. With the modeling that we're currently working with, we're still anticipating a surge. So there's been a lot of work with surge planning and how we collaborate amongst the 17 hospitals within the county. So there's a lot of potential updates, and I do thank Dr. Masiska and Dr. Leung for taking the time to be with us today. And I'll sort of hand the floor off to the both of our physician leads, and we'll sort of have a live chat here as they discuss updates, the happenings at the EOC. Please don't hesitate to enter in any questions in the chat box, or perhaps later on in our discussion, we'll open the mic up, if you will, to questions on your phone or computer. So without further ado, thank you both for being with us today, and the floor is yours.
Yeah, thanks, Gary. Appreciate it. So Jeff and I spent a lot of time together, and what I sort of figure, I'm working on the hospital surge piece, but when I'm constantly going around, turn your volume down so I don't have to hear myself say thanks. When we constantly follow Jeff around, because Jeff is working with the EPI team and doing all the modeling for the county. And so as we're building the hospital surge plan, we're constantly trying to follow along what is actually happening within our own county. And so we're constantly looking at what's happening internationally, nationally, and then I'll be reading something and I come back to Jeff and I say, Jeff, this is what I'm hearing is going on in the rest of the country. What do you think? But what's actually happening here? Because as we're building each of our hospital surge plans and our county-wide surge plan, we're mapping that out in a timeline to what we initially predicted or modeled versus what's actually happening on a daily basis. And so what we wanted to do today was really focus in on where we think we're at within our county right now, because as you're hearing, there's things coming out of New York that say that even though more people died yesterday, the hospitalization rate's coming down. So maybe they're getting a control on that. And then we're hearing that Washington and other areas seem to be slowing down, and that's not what we're seeing locally. And so Jeff's going to explain that, and then I'm going to ask him some questions along those lines. And then we'll show you where things are at today and some data, because we really get asked very often is how are things happening? We see that there's a total number, but what's the actual impact on our hospitals? And so we'll show you how we track that here locally, that all the hospitals are inputting data several times a day, so we can see the number of ICU admissions, we could see the PUIs and the COVIDs at every facility. And I won't be disclosing the numbers for each hospital, but we'll show the total numbers as well. So Jeff, why don't you give us a sense of where we're at in Riverside County right now and why you and I remain very concerned.
So thank you, Mike. And if I'm able to share a screen, I can just put up a reference. But certainly we see the pace of cases sort of spreading at the same rate. We've been tracking numbers since the very beginning, and we're doubling at approximately every 4.6 to 4.7 days. And we definitely have not seen a slowing. Um, some of you may have seen sort of a table or even a chart that kind of shows the predicted number of hospitalizations, predicted number of ICU cases. And we're actually tracking that very closely. We're following that curve almost within a day or two. So for instance, yesterday we had 1,179 cases, and we were predicting, just over 1,000. We were predicting around 150 hospitalizations, and we were at about 130, and predicting about 50 some ICU beds taken up by COVID positive patients, and we're right around 57 the last time we checked. So we're continuing to follow that line, and we haven't seen the curve begin to flatten. There is a lot of messaging statewide and across the country that many people things are starting to slow down. We don't think that's the case here, and we're actually worried that Riverside County, there may be a lot of places across California and across the country that may actually be like us, but are not testing enough. And so they don't even realize that they're like us. And if you look at the outbreaks that we're starting to have at skilled nursing facilities, assisted living facilities, within cohorted populations, that actually supports sort of where we think we are on the curve right now.
Yeah, so here's an example. About 3 weeks ago, because I also oversee correctional health. So 3 to 4 weeks ago, we started testing every inmate that got a fever, cough, cold, regardless of travel, even ones that have been in custody for several years. And that's why I think we have so many more positive cases, over 40 that are within our jails, compared to some of our neighboring counties who I know, and talking with them, they haven't started testing inmates until just recently. Right. And so the amount of testing that you see is going to affect the prevalence and it's also going to give you an indicator of what's going to hit your hospitals in a week or two later as people get more ill. And so the testing I know you're very passionate about is a means to know what's happening in the community. But, and then on that other end is one of the things that we're seeing a lot more in the press about was this here back in October and November? And I would also say that that's probably not the case. And I debate this with my own family every night because they're convinced that there's no way that this didn't come over from China sooner. Right. But we didn't see the impact in our ICUs. And I think that there's a very characteristic presentation and this is how they picked up on it in Wuhan, right? They had a cluster of cases that were in a very similar pattern in their pneumonia in certain age groups that just is not something that I think would have gone undetected had those cluster of cases been here months before what we've seen.
Yeah, I agree. We had the same conversation last night. My wife was actually asking me if I thought cases, were here in the fall, and I tend to agree with you. So, but in terms of testing, so if you think about other if you think about other counties, if they have limited testing, what can happen is if you reach your testing capacity, you may literally not be able to capture more positives than what you're doing. If sort of, let's say you can only do 500 tests a day, and that's your maximum, and it doesn't change, but you have infection that continues to spread, it may artificially look like things have started to level off, when in fact, what is actually leveling off is your testing capacity.
So I think that's what happened in LA County, right? So about 2 weeks into this, they said, well, we're going to pull all of our resources back into our hospital. We're going to stop testing. They made a public announcement to stop testing. And then a week later, they quickly changed gears. And now
Hey, Mike, I think the background noise is cutting you off.
It really is.
Yeah, and I think you hear that same sort of conflict at the state level, because on the one hand, they're talking about how they're hopeful that things are flattening off. And at the same time, they're also saying they want to increase testing fivefold throughout the state. So really that indicates that, number one, they feel like it is an important strategy. And number two, they don't have a good enough handle on actually what's happening.
Right. And then the other, I think, important thing about state testing is that we know that some states, some counties have done a much better job at slowing down movement. So you looked at cell phone data,
right?
And in Northern California, there's some areas that they've reduced from their baseline their movement by 80 to 90%, compared to down here where we were only maybe reduced it by like 40% from the last time. So looking at the whole state after testing doesn't always give you the best idea.
That's right. So Northern California does look like they're flat the curve. They do have a higher prevalence of tech companies. You know, Seattle, when coronavirus hit, they moved so many jobs. The same thing happened in San Francisco. They many essential jobs. Maybe and that
Dr. Leung, I think we're having some sound
Um,
issues.
and as a lever, we really need to look to the other strategies.
There you are.
Can you show are you able to share your graphic here?
Yeah, so let me see if I can,
For all those
if
visual people.
so I'm not able to, if I might need to be able to share my screen.
Yeah. So actually send it to me because I have the share button. I don't know if does he need a special thing, Gary, to be able to share his screen in there?
I'll send it to you.
Right.
So, you know, there are four main strategies that we think, in addition to sort of staying at home and washing hands, that can really decrease or flatten the curve. The first one is testing, which we already talked about. The second one actually has to.
While we're on testing, why don't you share, because this group here is going to be really interesting because they live in the county or work here.
Yeah.
So we have testing sites for drive-through that are up and running. I think everyone probably knows we're doing Lake Elsinore. We still have the one out in Indio that's running. There's a third one in the central area. Remind me where that one is.
Yeah, so we have Indio Fairgrounds, we have Riverside Harvest Church, and then we have Lake Elsinore Diamond Stadium. And starting on Tuesday of next week, we'll have Paris Fairgrounds.
Yep, and our folks at Hemet Valley, the Global, have a process that they have been doing drive-through testing as well.
Right.
And then some of the emergency departments, I know Eisenhower has adjacent to their emergency department a place for testing. And then all of the community health clinics have the ability to do testing in their parking lot in a system like that. So I think when I looked yesterday, is it 16,000 people?
Yeah, so we think that including RUHS, non-RUHS, Kaiser, other groups across Riverside County, about 15,000 tests have been done on coronavirus. A good number are still pending. So, you know, our positivity rate is about 1 in 12 right now in Riverside County. And I did send you the graphic. So in addition to testing, and in addition to sort of hand washing and staying at home, we know that one of the other measures that works really well is closing non-essential businesses and places of gathering. So some places have been more aggressive about this. You've heard, you know, recently in Los Angeles County, they've closed all beaches, and you know, really making sure, especially with Easter coming up this Sunday, we hear a lot of rumbling about, you know, how people are either going to gather virtually, but unfortunately, we still hear about groups that are planning to get together in person. And so as much as possible, we want to discourage gathering. We actually have orders from our public health officer for no gathering, as well as for covering the face, which is another measure. But before getting to covering the face, enforcement is actually a really important piece. You see in Los Angeles County, counties, that they are now ticketing and fining individuals for either gathering, for being out for non-essential activities, or for not covering the face. We know that from Asia, actually, you know, there's some countries where sort of masking is much more part of the culture, but a place like Japan is very interesting because Japan, they didn't do a very good job with testing. They did do closure of schools and non-essential businesses, but they also did masking and sort of they really only did 2 out of these 4 strategies. They're one of the only countries that did only 2 and were able to bend their curve. In most cases where we look at countries that have flattened their curve, they usually need at least 3 out of 4 of these measures. A 5th one that we didn't put on there, which is sort of politically more challenging, is large-scale community quarantine, which is what you saw in Wuhan. But on the enforcement piece, actually yesterday, a soft enforcement tool we've added on Rivco. There's a Rivco mobile app, and it may be difficult to see, but this is there's you can see the tile for the Rivco mobile app.
Does it come with the kids?
You can take them if you want.
Okay.
And under Rivco Mobile, if you select coronavirus, under there's actually a place where you can. Oh, you probably can't see, but there's a tile where you can report a health violation. And if you select the report health violation, you can actually take a picture of individuals who might be gathering. You can take pictures of people who might be working at the store who aren't covered, and you can actually send that in. And that will go straight to what we're sort of kindly calling our snitch line office. And then they will reach out in a gentle manner, first to those businesses or places or places of residence, make sure that those individuals know that they're violating public health orders. And if that's not enough, it'll get escalated. So that's sort of a softer way for enforcement, and we hope that people utilize.
I think we need to work on a better title.
Yeah.
And the community awareness line.
Yeah,
That's all right.
yeah, absolutely.
So, yeah, I think there has been some pushes within our county to do more enforcement, and I think people agree having some level of enforcement is good. There were folks initially wanted that to talk down, and when you think through that a little bit, like in Wuhan, when they initially did that, several million people left immediately. Right. And so when you bring in a martial law or a militaristic approach,
right,
that you actually run the risk early on of having spread out. And I don't think many Americans have this.
Yeah, I don't think we're ready to close all of our highways. So, one other strategy is the covering of the face, and we're really, we do feel like this has been getting picked up across the county. Just doing spot checks, we think there's probably 70 to 90% compliance. And if we can do that really well, and the testing, we're actually getting close to testing, almost 1% of the population. If we can do those two things, I think we'll start to see the curve at least bend.
Yeah, and I think we're right. We were the first county in the state to do that.
Right.
I think most people probably don't know that you personally, largely, I think, had a lot to do with. I know you did for our county, and then with the fact that the state and eventually even the CDC. I think it was a lot of your research and your advocacy that really pushed our entire nation in that direction.
Well, I think a lot of people were sort of on the fence and they were considering it. And when Riverside County was one of the first places to push it forward, a lot of people felt like, okay, well, I don't need to be first. There's already been a precedent, and now we can follow. And so, I think there was some inspiration from our county.
Well, and we believe all solutions are local, at least the best ones, and I think it's a good example for it. I think similarly, our hospitals have done a really good job supporting our healthcare workers. And, we had big debates early on about just masking our healthcare workers and concerns about not having enough masks.
Right.
And I know you and I were both big advocates for that. And as we got just a couple hospitals in the county to do it, and all the others sort of had to follow suit. And I think we've seen that over and over again. That people are willing to be brave and lead, whether it's school closures or universal masking. That there's a lot of agencies that want to do the right thing. They need to nudge or push in the right direction.
And some of you may or may not know, but when we received the first plane from Wuhan at March Air Reserve, Mike was actually instrumental in really pushing all those who were working at March Air Reserve to start using PPE appropriately. And at the very beginning, social distancing was sort of the strategy that the CDC recommended, and I think it was largely because of Mike and your nudging that things changed.
That's other people use other words for me in that respect. So, well, Jeff,
Dr. Leung and Dr. Masiska, can I ask a question with respect to testing? There's been a lot of discussion around the supply lines.
Right, we're appealing to the state to get some of the Abbott machines here. We want the point of care testing. You're leading the task force to get more technology in our own county across multiple agencies. Many of our hospitals have gone online with internal testing to some degree or another. We've seen more closure of businesses. You and I have argued that there are a lot of people that want to be essential or are claiming they're essential. You know, as a Christian myself, it pains me to see worship teams still gathering instead of just doing it remotely. You know, Harvest Church still gathered their worship team this last weekend and didn't wear face covers. You and I saw from Seattle, to our folks in this crowd, Google it. There was a church group that got together with 60 asymptomatic people, and 45 of them got infected as a result of gathering and singing. So the data promoting aerosolization, which you and I have always said that there's aerosolization of this virus, and we also push the state agencies to not revoke the aerosolized protection for people that are in the healthcare environment. We're really pushing, you know, churches to do the right thing, you know, and we understand the desire to gather, but God gave us technology, we need to use it. And it does put, every time that people leave their immediate social network and interact, you know, even here, we kind of stay in the same groups at the EOC and try and minimize, you know, face-to-face contact with people that aren't within that same cluster of groups. So, you know, I think we've seen our law enforcement agencies, we've got them masked, but they're still gathering at times, and we've been putting a lot of pressure on them to not huddle and not meet. So that, you know, shutting down the gatherings as much as possible. It's refreshing to start seeing our food workers and other people like that wearing masks because they're super exposed. The enforcement thing's happening, and then I think we're starting to see, you know, our neighboring counties were slow to this, but now they're doing universal masking. So, but with that, we want to be very clear. We do not see a flattening of the curve. So I'm going to share my screen. I think I need to do something different here. I'm going to stop sharing, pick something else here, and then try and share that. So this is a highlighted section of the dashboard. So this is what we look at every day, and this is why it's so critical that our hospitals that are on this call are updating this information, because this is like our pulse on the county. And so you can see in this chart that the light blue is the ICU. This is all ICU patients, and you can see the suspected or the PUIs that are in the ICU is that light blue color. And then the dark blue is the number of ICU confirmed cases. And so we see this upward trend. I think what's interesting is it does look like the two lines are coming closer together with time. And I wonder if some of that is just that we're getting our tests back quicker. So you have fewer people in the ICU at any given time that are in the PUI category. They're shifting up. But what we see here is this trend that really matches almost to an exact precision level of what you've graphed out in terms of our modeling. And so we were at, 111 cases 2 days ago. And then today we're at 114 as of yesterday, and it hasn't been updated just yet. So 114, we have 395 licensed ICU beds. At any given point, those are 80% full. And so we're nearing that point where we think we're about 2 days away from the ICUs, 2 to 3 days away at this rate for the licensed ICU capacity in the county to be full. So we've done a really good job creating capacity in our county, canceling the elective surgeries. Our ER volumes are down. Our trauma volume is down because people aren't driving. They're not in bars drinking. It's incredible the social impact that we've seen. We even see fewer people that are high on meth in the department right now because I don't know. But social distancing has had a huge impact on, trauma and other typical parts of ED volume. And then I think people are also scared to come to the hospital unless they're really sick. So we've created capacity there. So going into this, we're in a decent amount of shape, but we are seeing an upward trend across all the hospitals in the county in our ICU volume. And what we don't know yet is where is that going to temper off this week, or is it going to keep progressing? And that's what between the two of us, we'll keep looking at. On the surge plan, so a couple of things for those of you that are still tracking with us. There's a few things that we need your help with. One is that, and I'll probably come back around either early next week, and we'll do an update just on hospital surge planning. But I think this is a captive audience. I think you're all very engaged. We have received the surge plans from all 17 hospitals. We are on our third or fourth round of meeting with all the CEOs and CMOs in the county to revise and build those surge plans out. So we have quadrupled throughout the county the number of ICU beds in our building. Some of the hospitals have gone from like 30 to almost 200 in their plan of ICU capacity, which is amazing. Right. And we have plans to build out surge beyond that. But one of the things that I'm hearing that was brought to my attention today is that there are frontline physicians, ER doctors, ICU doctors in some of those 17 hospitals that don't think there's a plan. So I need this group today to go to their administrators. If you don't know what your plan is at your facility, you need to call your CMO, or you need to talk to your medical director. If you're a physician, if you are an RT and you're not the supervisor and you don't know what that staffing model is, where are those patients going to go, and you want to know, then your institution needs to have some sort of mechanism internally to communicate that. So I know Kaiser and RUHS, for example, and I think HCA, so a number of the hospitals, they have a daily meeting of all the department chairs. You know, you and I are on that for our facility. You know, our CMO facilitates a daily update that then the chairs are responsible to make sure their department is aware of what's going on. So, and that's a remote, we do that digitally. So there needs to be some mechanism at every hospital where the leadership team and then the leaders, and we've done this too. So like my ER group is meeting 3 times a week now through Zoom. And so it's my job, and I have a team, you know, that's taken over most of my daily responsibilities there that are telling the team what those plans are, because people are scared. And, you know, there's 3 keys to managing any disaster. And there's always 3 things. In every disaster debrief that we do, there's always 3 challenges. It's always the same thing. It's communication, communication, communication. When something goes wrong, it's those 3. When people are upset, it's those 3. And so we can't, there's no over communicating in a disaster. So at the point that people are tired of hearing it, then that's when you can move on. But I think, so communication, making sure that those plans are being shared, because there's no point in having a plan if people don't know about it. And then the other part is that we need volunteers, but we don't need volunteers from this group. We need you guys in your hospital, but we need your networking. So if you know nurses, CNAs, RNs, LVNs, RTs, PAs, NPs, physicians that normally work in a community environment that aren't tied to an acute care hospital, that are willing to see COVID patients, we need them to volunteer today. The county will pay them. They will provide malpractice insurance for them. But one of the key areas that we are most challenged with right now is supporting our nursing homes. So yesterday, this team was probably watching on the news, we evacuated 86 patients out of a nursing home in downtown Riverside. And we had to create several destinations for them, but there's a number of them whose destination was not optimal because we didn't have the staff. So we've had 150 people in our county volunteer to support this effort. And when we called every single one of them, they said, we'll help, but we don't want to see COVID positive patients, which there might be a place for those people to help us in this. But what we need is people that are willing to do that. We're going to provide them with PPE. It'll be hospital level PPE. We moved these patients too out of that facility because it was dirty. And we are going to put our patients into clean environments. We're not going to send volunteers or these workers into a place that you and I wouldn't go into either. So, and we're going to provide them with the same PPE that you and I would wear to see these patients. And so to this group on this call, and this is a bell we're going to be ringing all day through the media and everything else, is that we really could use some staffing help to keep people out of the hospital, right? We want the acute care beds in the hospital for those patients that need those level of services, and we need to be able to support the SNFs in the community, the rehab facilities, the elder care, with the staffing that they need to keep those patients out. So, all right, any questions or comments, Gary? What do you got for us?
And nice job, gentlemen. If there are any questions, please don't hesitate to put them in the chat box, or if you want to unmute your phone or computer, please voice those questions now. Well, I don't have any questions coming through, Dr. Masiska, Dr. Leung. I think you did a wonderful job sort of discussing some of the hot issues that are going on at the EOC, whether it be testing, the mitigation strategies, the challenges with staffing in face of our anticipated surge. You guys are, along with the rest of the EOCs, are doing a fantastic job, really pulling the county together and making sure this is a collaborative effort. So we thank you very much for that. We are just about out of time. I'd like to be respectful of everybody's time. We're at the 30-minute mark. I do want to express my appreciation for Dr. Masiska and Dr. Leung today for giving us a bit of a nice update. As we move forward with this webinar, it should be great to have you back perhaps next week to give us another update on how things are going. We are obviously cautiously optimistic and hope maybe by then we'll have some better news with respect to the curve, and perhaps we'll see a little bit of flattening by then. But clearly a lot of work still needs to be done. We need to continue to express to our community the importance of these mitigation strategies that both of you have emphasized so greatly as we attempt to flatten that curve. I know that every hospital is working terribly hard on their surge planning, and as we are here at RUHS, trying to be as prepared as possible. So I just want to thank you both. Thank the rest of the county partners that are on this call. Really extend my appreciation for all the hard work and effort that everybody is putting forth here. I think this is an amazing collaboration that we've been able to put together with the county, led by you two folks. And I think this webinar is really just a small piece of that to sort of get our clinical leadership together to talk and share ideas. So thank you very much. With that said, we'll go ahead and close this webinar. Tomorrow, we have our chair of pediatrics, Dr. Chad Versio, on. He'll be discussing the care in cars concept and program that he's putting together. So perhaps that'll be a little bit of innovation that many of our county partners have not implemented at this point. So we're excited to have that discussion tomorrow morning, 8 o'clock sharp. So thank you very much, everyone. Everybody, please be safe and keep up the hard work, and all the best to you. Take care now.